Hi, everybody. This is Ryan from Athletic Conceptual Training, and we're bringing you another interview from the veterinary profession. We have RVT, Registered Veterinary Technician, Edie Ford. Edie Ford brings a wealth of experience, and we're lucky and excited to speak with her today. Thanks for joining us, Edie.
Thank you for having me.
What got you into the field? Tell us from the start what happened. How did you choose the animal profession?
So it kind of roots deep in my roots. My mother was big in vet med and animal care as well as marine biology. So being able to kind of continue that and find my own route and my own species per se has been kind of a fun adventure throughout the last couple of years. I definitely went a different route than the rest of my family with small mammal and exotics, but emergency med and internal medicine have been kind of where my heart is.
Was there a specific turning point which you knew that the marine biology wasn't for you and internal medicine was for you?
I kind of bonded with an internal medicine clinic initially during school when I was doing my clinical rotations and kind of feeling out all the different ways that you can go with your vet license or veterinary license. And I ended up watching a really tough cancer case come back and make a full kind of recovery and got an additional, I believe it was an additional like 6 years on this older dog, which was an incredible feat. So
Wow.
kind of stole my heart with that one.
Yeah. Who were the major influencers or mentors that shaped your mindset early?
Oh, so I have two of them. I would say my original mentor, Dr. Dave Davis, who used to work in the Citrus Heights kind of area. He'd been doing this since Reagan was governor way back in the day. And so he kind of gave me a new approach to, finding outside of the box ways of treating different things when owners can't exactly, come up with the finances to go what would be considered best medicine. He would come up with these out of the box ways to still get treatment for these pets that was a little bit more financially cost available for them, but still an effective treatment, which was kind of a cool idea. And then Dr. Katie Wallen, who is a surgeon that I got to work with pretty frequently in emergency when I was a baby emergency tech back in the day.
Yeah.
She has been she was a great mentor throughout the program. And she also kind of helped me get my confidence, the waxing and waning confidence that is a technician. You'll go through your imposter syndrome moments. And she was kind of able to help me get through that at the end of a tougher health kind of scare for myself.
That's amazing. It always feels good to have that type of support as you're going through and learning and growing.
Yeah. Makes a huge difference.
So really quick, let's jump into the role. What is, in your words, a registered veterinary technician?
Ooh, a Swiss Army knife. I think that is like the best way you can say. A lot of people like to compare RVTs to RNs, but really it's kind of a more multifaceted role. Whereas everybody knows we do the nursing side of things, they also, veterinary technicians, not even just registered, but VAs as well, will slide in and out through client care, communications, as well as pharmacy technicians, radiology technicians, phlebotomists, surgical monitoring, things like that. So I think Swiss Army knife is the best I can come up with that because everybody uses their skills differently.
Yeah. What's the biggest difference between working in a regular clinic and an emergency veterinary clinic?
Thinking outside the box is another thing, and also being able to kind of understand that the reactions you're going to get from people are not exactly going to be logical. So you'll get a lot of emotional based decisions, or you'll get decisions where they'll just choose to take their pet home with no care, whether that be due to their own belief system or finances, and just kind of learning not to judge in those moments, I think, is kind of the hardest part to get the hang of. But just like that and the pace. I think the pace is a lot faster paced in ER. Though I think on the general practice side of things, they also have their own set of things because they have their, they have their regular scheduled clients and things like that on top of walk-ins, or they'll have cases that are supposed to be, general wellness cases that turn into a case with 12 problems that you now have to do a full workup and it no longer fits into your time period. So I think both have their own adaptability sides. They're just kind of two different paces.
Yeah. I love that the veterinary field has the options of the general care and an emergency care as well.
Yep, and then you add urgent care in there nowadays, which is newer, to kind of help take some of the relief off of the ER, those emergency ear infections, you know, things like that.
Walk us through what a typical day or night shift looks like for you.
That is such a hard one, only because, as you know, every shift is going to be so vastly different. I love to work weekends. My primary, I like to work overnight work on the weekends because it can be a little bit more fast paced and a little bit more full. That being said, that has not really been true the last couple, I would say 6 months or so. I feel like it's been reversed. So it's been up on the first side of the week. So it's kind of hard to gauge, but I think, first thing you should ever do when you walk into a hospital is figure out where you're going to be for the day, and then get your patients rounded to you and be able to kind of double check your plans. And it doesn't hurt to always double check everybody.
Let's talk about the emotional side of things. What's one of the most heartwarming cases you've experienced? And on the flip side, what has been one of the toughest moments?
So I think the most heartwarming case I ever saw was a hemoabdomen that came in. This dog was, for lack of a better way of phrasing it, next to dead. He came in with a hematocrit of, I believe it was like 7%, and had multiple reactions through the blood transfusion. We ended up having a calcium issue, so we were running calcium gluconate, and then our heart rate drops down to nothing. And so it was one of those cases where really we were kind of throwing everything that we could at them, and no, prognosis wasn't great. And that dog ended up going home 2 days later, was eating, drinking, looked like a completely different dog. And I think even on the medical side, when we weigh statistics and things, I don't think anybody would have put money on that dog. And he kind of showed us the other side of what that looked like, which was really refreshing to see, because we all cheer for our pets when they get to go home, when they've been on this ICU for a week, and I will walk my own pet right on out just because we're all cheering and happy they get to go home.
That's such a good feeling.
And then on the reverse side of that one, we had probably the most heartbreaking case I ever had was a dystocia that came in. It was an older lab. I think she was 7 or 8. Should have been spayed quite a while ago. Owners didn't know she was pregnant. She went into labor. We ended up doing an x-ray on this older lab and found out it was one very large puppy. The owners elected to not spend the money on surgery, and didn't want to pay for the money to induce or to try to help with labor. So they ended up signing an AMA and just taking her home.
Oh my gosh.
And it was heartbreaking because the last thing the owner asked me was, how long is it going to take for her to go septic? And they put the time period on it like that, as if that's how much time they had left with her. And they were comfortable with that. And though we're not supposed to judge, I will say I went home teary-eyed with that one and probably cried my way home on that one, just because it was like, you want to help them, but you can't make the owners want to.
How do you stay emotionally grounded while dealing with emergencies, life or death situations, and pet loss?
As probably not the best as it is, I'm pretty good at compartmentalizing in the moment. So usually I will still let myself feel those, but usually it's in that car ride home, right? Or I took up running, because running is a great for getting that aggression out, or getting out some of that angsty feeling of not being able to do enough, right? So that's been really helpful. But at the end of the day, I kind of just let myself feel it. It may not be in that moment, but you have to feel it through, because the more you hold on to in this field, you're going to have multiple sad cases in a day. You have to kind of be able to let yourself cry it out and feel mad or feel angry or all these things, and then come back in and restart the next day.
What are some of the surprising things people don't realize you have to know or do as a vet tech?
Oh, there's so many. I think the biggest one, just because of the season right now, that pops into my head is neonate care.
Yeah.
A lot of people don't realize how much goes into neonate care, whether it's like the surface area to temperature ratios and things like that, or stimulating so that they can, you literally have to teach animals how to go to the bathroom.
Yeah.
You have to teach them how to latch and things like that. And I think people don't quite connect the fact that with babies, you have to teach them everything.
Right.
Same thing with neonates in the vet field. You kind of have to start from square. They don't know anything.
Right.
That and that people don't know that there's a kitten season or a puppy season, where we just get litters and litters turned into the hospital, and people just don't know about that.
Right.
And I think for all of us, it hit early this year.
Yeah. How important is communication between techs, vets, and even pet parents during a crisis?
Vital. It can turn into a case of life or death if things are not being communicated appropriately. We actually had a meeting about this at one of the other relief hospitals I was at, about like the difference between like an in-house fatality versus like an induced fatality, right? So I think communication is huge, because that's the difference between overdosing a dog on a medication or doubling up treatments or not doing treatments at all, because you assume that somebody else did them.
What's one big misconception people have about your job?
That we're after the money. Because how many people like think, vets just want money, this, that, and the other, but how many vet techs can't pay their bills, right? Because we're working for next to nothing. Just trying, because this is what we love to do, how many vet techs do you know that have 2 or 3 jobs, or have to work relief? I know a lot of relief technicians are in a different town every day. They're working 30 plus days straight, things like that. So I think that's a big one.
Thank you for that. Training and certification. What does it take to become a registered veterinary technician, and any advice for young people interested in this path?
So there's 2 ways to answer that. So technically, to become a licensed veterinary technician, you want to do your an associate's degree in the state of California, plus passing your VT&E or your federal boards. We don't have a state exam anymore, which is great. They did away with that since I got my license, which is nice. That, and then there's the actuality into practice. So you can have the license and not have the technical skill, because you're being book smart and being technically able are very different things. My biggest advice is, while you're first stepping into the field, keep your mouth shut unless you have a really good question, or you have a question in general, and absorb as much as you can, because every technician you work with is going to come from a different generation. They're going to come from a different set of what was normal or what was standard at that time. I feel like every year there's a new study out, right? So everybody's way of general handling is going to be a little different. But absorbing and not being so set in your ways that you're not willing to learn something new in a different way. Or an outside of the box way. I had a baby technician recently taught me a new way to burp a fluid bag. I couldn't even explain. I'll have to show it to you. But it was something that I would have never thought of, and it was like, that is brilliant, because it avoided that oversuction with the burettes that we always deal with. And so it was like, dude, you're brilliant. And it was because that's just something she had thought of off the top of her head, and now we can start to apply it, because it's something she knew.
Why do you believe your role is crucial, not just for animals, but for their families too?
I think our role is crucial simply because we are the point of contact between vets and the clients a lot of the time. Because there are so many clients and so few veterinarians that the technicians kind of have to pick up the communication in the middle. That, and also kind of translating. So sometimes people will say things in a certain way, or they'll ask a question, but it doesn't quite logically make sense. So we kind of have to like take that in, absorb it, and then reinterpret it back to the doctor of what they're really trying to get answer wise versus what they're actually asking.
Fair. What do you love to do when you're not saving animal lives?
I love riding my motorcycle. I think that's the biggest one for me. Going for runs or hanging out with my own animals, as infrequently as we all get to do that nowadays. I am a very couch potato. So if you can get me a book or my motorcycle, we're good to go.
There you go. Final thought. What's one thing you wish everyone knew about emergency veterinary technicians?
I wish everybody knew that every technician that you meet, especially like overnight swing, daytime, emergency specific, every technician you meet is going to be putting every ounce of heart that they have into that shift.
Yeah.
And I feel like sometimes people get tired or they get burnout, and people it's so easy to say, oh, you're not doing your job or you're not doing this well. They're doing the best they can in that day. And what's best today may not be the same as what's best tomorrow. Yeah. Right. So that's kind of the biggest one.
I love that. Well, Edie, thank you for spending time with us and just educating the world a little bit on, what it takes to do our job. And
absolutely.
I think the more education we can do is going to be helpful. My last question for you is, who would you suggest that we interview next, but you have to help us bring it along?
Got a couple texts that pop into my head. There is another root technician that I work with. I frequent over on the med vet side of things, named Katie, and I will contact her. Yeah. She's an amazing RVT with her own, we all extensive health history, who perseveres through her own physical kind of limitations and things like that. And I think she's just a phenomenal technician and a bright, wonderful person to hang out with. You'll see her over here. She frequents here too. Okay.
Really quick though, I know before we leave, you alluded to health limitations, and I really, if you feel comfortable, I would love you to just quickly, not too long, elaborate on some of the things that you've gone through and overcame to be able to be here to provide the care to our families and these pets.
Yeah. So about 4 or 5 years ago, I was diagnosed with adrenal cortical carcinoma, which is adrenal cancer. I had other health issues because I've had Crohn's my whole life. That kind of led downstream to some kidney issues. And they were able to find stage 3 cancer on accident. Following that, I started treatment I did immunotherapy, I did chemo radiation, as well as just solid chemotherapy on and off for about the last 4 years or so while still working full time. I will say it gave me a better understanding and a better kind of empathy for these really sick pets. And there have been a couple cases where like we have our kidney failure dogs that are on hospice, they're in hospital on treatment. And I'll tell you, there've been a couple times where I'm like teary-eyed because I know what that feels like. And I'm over here like give them a little bit of extra pain med something, you know what I mean? Like it's ouchy. You can't see, but it doesn't feel good. And so I feel like it's given me a better understanding of what these pets are going through on what they can't say. Plus it's also given me kind of a better something to fight for, right? Because there's been a couple, touch and go cases. I have lots of teams that I've worked with where they're like, you about to die. But overall, I think it's kind of helped me push through my own illness, being able to kind of be there for the staff as well. And then having the amazing teams help me kind of adjust, like, running codes and things like that when we're getting tired and we need to tag out, right? Those 2-minute rounds, they last a long time.
Guys, we just did a code, and Edie and I tag team CPR together. What, 10 minutes total?
It was 10 minutes, or I think we did 12 minutes total.
Okay.
Oh, that was tough. And your age starts to show as you go.
Well, Edie, thank you again for joining us. This is really amazing, and I wish you nothing but the best in the future. Everybody check this video out, and we've got more to come. Have a good day. Hey guys, this is Ryan from Athletic Conceptual Training. We're serving the Livermore area, and we really want to partner with you. Students, if you're ready to get better in basketball, volleyball, tennis, come and check us out. Look at our Instagram. We have a lot of content, and we got more coming. We're one of the fastest growing company in the Bay Area, and there's no other place to be. Parents, if you really want to unlock the potential of your student athlete, come and partner with us. Or if you yourself want to come out and get some training with Coach Ryan, don't hesitate. All you have to do is click the link below. Unlock your fullest potential. Be ready. Get up, act today. Let's see you soon.